Good morning, it's me, Susan. I'm getting ready to start out on my adventurous day, first day of my cancer treatment. This morning I'm going to have what's called a PICC line inserted into my arm, and then that has a tube that threads around inside my body and heads for my heart. That was kind of creepy to learn about, but apparently it's a safer method of delivering continuous chemotherapy than a lot of the others, putting in a port or other central line kinds of delivery systems that there are. I have a list of questions. I'm going to not be shy about asking them. In fact, I already called them and asked them the first one. Somebody wondered if I would need a driver because I think they use some sedation, I'm not sure. So I called and asked that, and the nurse was like, "Oh no, you'll be fine." So I'm going to be fine, I assume. Sorry about that. Trying to keep looking at the right place on the camera so I don't look like I'm staring off into space. I urge everyone to ask questions. I've even called the doctors a couple of times to when something came up or someone asked me something I didn't know in between appointments. I'm the patient. I don't think there are any stupid questions. I'm making choices every step of the way, and I want to have answers. I don't think that's unreasonable. So I will ask her my questions and go ahead with the procedure. Then I head over to radiation to get my radiation treatment, and then on to chemo, get the chemo actually hooked up to the PICC line. The PICC line is just the delivery system. The chemo itself has to be done somewhere separate. One kind of amusing, typical me kind of thing I did was, at first I thought, okay, I want to be as normal as possible as a kind of baseline. I want to feel fine, do my normal activities before today. But then over the weekend, I did two things that I don't normally do. I went and got not only a flu shot, but a pneumonia shot, because I started to worry that my immune system was going to be depleted, and I needed those shots. I did call and ask, and they said it was fine to do that. But now I feel a little weird from the shots, although I never normally do. I'm probably making that up in my head. And I did a new, brief but very intense workout with a heavy punching bag. And I did that on Saturday. I felt fine yesterday, and this morning I'm kind of achy all over my upper body. So that's going to help to confuse me about what side effects or what symptoms I'm having from my treatments. But that's just me. I guess that's the way I do things. Sometimes I overthink and end up with things a little bit more complicated than they need to be. But I do basically feel pretty good. And we will, I don't think they're going to allow me to film any of the procedures today. If you want to see what a PICC line insertion looks like, you can go on YouTube. In fact, you can see just about anything on YouTube. I did some more research last night on anal cancer. It turns out that is what killed Farrah Fawcett. And there was some kind of scary stuff on there. But that was mostly people with stage 4, so I'm still kind of excited and happy that I caught it early, and like I said yesterday, who knows, but anyway, so I've done all my research, I've got all my questions, I'm ready to go, and I will catch you later. Okay, bye.